streamed on YouTube. Welcome to the Nevada County COVID-19 Business Task Force of September 1st, 2021. My name is Marnie Marshall, and I am the Business Outreach Coordinator for the CEO's office, and I'll be facilitating this meeting today. First off, I'd like to turn it over to Supervisor Miller and Supervisor Schofield to provide introductions for this meeting. Welcome,
well,
everybody.
Ed, let me see. We've had fires, we've had COVID, we've had high school football. Then we haven't had high school football. Let me see. What else? Ed, what else has been going on? Huh?
Well, we've had in-person meetings
That's it.
and gone back to virtual.
Zoom meetings. Yeah. We've had lower mask restrictions. Now we've had higher mask restrictions. And I don't know what this is going to do to high school football and how the high school is going to handle checking people through the gates if they have more than 500 people. Well, we know there's more than 500 people who go to high. Well, fortunately, our game this week is down in Placer County, and they don't have those same type of restrictions. Don't have to worry about it this week. Next week, gonna have to worry about it.
Is that it?
It's all about football, Ed. It's all about high school football.
Well,
What do you say, Mr. Supervisor
I'm
Schofield?
ready to turn it over to Ryan and the rest of our speakers, Marnie. So thank you.
All right. Well, with that, we'll introduce Ryan Groover, the Director of Health and Human Services Agency for Nevada County for a COVID-19 public health update. So Ryan, we've got a few things on the agenda, starting with vaccine updates.
Sure. Thank you, Marnie. Thank you, supervisors. Glad to be with you again. I wish it was under better circumstances. I definitely appreciate and am right on that roller coaster with you in terms of going back and forth and up and down. So wish we weren't there, and but here we are. So in terms of vaccine update, in Nevada County, we have 110,000 shots in arms for Nevada County residents, which is a huge accomplishment for our medical community that participated in that. For our team, that translates about to 60% of our eligible population that's fully vaccinated. That's better than some of our rural Northern California counterparts, but clearly not as much as we need in order to really get a handle on this virus. Our public health team typically delivers between 1,500 and 2,000 vaccines in a normal year, but this has definitely not been a normal year. And since December, they've administered more than 20,000 vaccines as part of their direct efforts. So some recent updates on vaccines. Recently, the FDA provided full authorization for the Pfizer vaccine. So it's gone through the rigorous testing that any vaccine goes through just through routine testing. We're still waiting on the vaccine front, full authorization for the other vaccines, and authorization for vaccines for kids under 12, and then booster shots as well. So make a distinction between what's currently available for people that are immunocompromised, which is a third dose of the vaccine, and booster shots, which are sort of a refresher for everybody else, and that latter has not been made available yet, but we'll keep people posted as that situation changes. In terms of, I think the next item, Marnie, was a public health update. And so I'll just dive right in. I'll start with the Delta variant and share that the most recent information the state provided is that 98% of the samples that they're doing genetic sequencing on are turning out to be Delta variant. That sampling is done. It's not something that's done every time a test is taken. It has to be genetically sequenced. It's asymmetrical throughout the state. We do get some results, and in recent weeks, 100% of the samples we've received have been the Delta variant. So that I think we can assume that almost all the cases that we're seeing are the Delta variant. We're, as a result, in the midst of an unprecedented surge over the last several weeks, and that uptick includes an uptick in cases among children 0 through 17. So if you keep track of the age ranges, we've seen a lot more cases in that age group in recent weeks. Hospitalizations trail new cases by a couple of weeks, and we are seeing high numbers of hospitalizations as well, especially in Western County. It peaked at a record number, I think, a week and a half or 2 weeks ago, and it's down slightly. I definitely want to quell the rumor that was sort of circulating out there that the hospital was overwhelmed and denying care. That was not the case. People had posted about ambulances queuing. That happens sometimes at their busiest hours, but we've been in close contact and coordination with them, and they have not been denying care. Deaths trail hospitalizations, and tragically, we had 10 fatalities hit our dashboard in August. A little bit of information on vaccinated versus non-vaccinated. Around 20% of our cases are tending to be in vaccinated people, with 80% being in unvaccinated people. And so you can actually project out, based on our knowledge of the efficacy of the vaccine against severe symptoms, based on our vaccine rates, what you would expect. And if you do that arithmetic, it comes out to almost precisely 20%. And so we're seeing around the percentage of cases in vaccinated people that we would expect to, based on our rates. The vaccines are even more effective against hospitalizations. They've reported around 10% of hospitalized patients are vaccinated, with 90% unvaccinated. And then the deaths, I don't have specific statistics. I've seen national and statewide statistics, but deaths, it's even a smaller percentage in vaccinated individuals. So the vaccines are less effective than we hoped at preventing people from getting and being able to transmit the illness, thus the roller coaster on masks and other things, but are still extremely and incredibly effective against severe illness and death. And so I think it behooves us as a community, and certainly as people in the healthcare field, to encourage everybody to get vaccinated as soon as possible. And the resources are available through myturn.ca.gov. I think the next thing that you had on the agenda was to talk a little bit about outbreaks in workplaces and resources that are available. I know we're seeing outbreaks in a variety of settings, just with COVID so widespread in our community. An outbreak is defined as 3 or more cases in a single business over a rolling 14-day period. So if that 14-day period basically being the transmissibility period for a case. So if an employee is positive and is nearing the end of their COVID isolation, and then 2 employees become sick after that, that counts as an outbreak. So 3 people are positive because 3 people are positive at the same time. A workplace outbreak triggers additional reporting requirements under AB 685. We have a lot more information about this out on our website to help people navigate, as well as a phone number and an email address, and I'll go ahead and put those in the chat. If you are experiencing outbreaks in your workplace and you're not sure what people should be doing with regards to quarantine, isolation, and testing, we're very happy to assist with that. So I'll go ahead and post that out, and I think I'll pause and turn it over.
Perfect, thank you. And just a reminder, if you guys have any questions, put them in the Q&A or in the chat at the bottom. We'll gather those questions, and if we can't answer those questions today, we'll pass them on to public health and we will get back to you. So next on the agenda.
Marnie, I got a question for Ryan. Hey, Ryan, when Doc Kellerman did the amended order, what did he take into consideration? Because I'm getting questions like that every day now. Did he take into consideration high schools, churches, special events, everything as far as how that would affect crowded outdoor?
Yeah, so I think the idea was, or what they were basically considering, is events where people are not just coming and going, they're in continuous contact with people in large settings. And so the intent is not for it to apply for something like a farmer's market where people are coming and going and they're not with people the whole time, but something like an outdoor concert or an outdoor event where they're sitting next to each other. The intent would be that it does include that. If there are specific settings and questions about that, we would definitely be happy to look into them and provide clarification. I believe we're doing FAQs and sort of helping people interpret how the order applies. So,
do we have any idea of what other California counties have gone to the the more extreme measures like Nevada County has?
I don't have a list. I know that there are a variety of, it's because the state is not taking action, because we are seeing county by county approaches at this point. It's sort of all across the board, and there's different approaches for different localities. And unfortunately, I don't have a comprehensive list of that. There are definitely restrictions.
Yeah, I did see a number of counties were doing the same thing.
Mhm.
That's all I got, Marnie.
Okay. Well, next, we'll do a little business resources update. I'll just do some of them, and then I'm going to hand the rest to the rest of the panelists, like Sierra Business Council. So know that there is plenty of PPE that the county is giving away for free. And I'm putting the link here in the chat. You can also just Google Nevada County free PPE, and it'll come up. As Tim pointed out in the Q&A, Perkins, sorry, there are 900 bottles of sanitizer and 48,000 masks to be had. So please do take advantage of that. Spread the word. You need masks or sanitizer, you sign up for free, and then you get an email confirmation, and you can go pick it up in Grass Valley, in Nevada City, or Truckee at the locations on the list. And so we've got Grass Valley Chamber of Commerce, Nevada City Chamber of Commerce, Nevada County Contractors Association, SAP Manufacturing, Penn Valley Chamber of Commerce, Truckee Chamber of Commerce, and the Truckee Downtown Merchants Association. So they all have different hours, so you just need to check when you're picking up if they're going to be open. But that is out there for everybody, for small businesses to sign up for. We also wanted to remind everybody about the Nevada County Relief Fund efforts to raise money for the river fire victims. So far, many donations have been made. People are very generous, and Sierra Nevada Memorial Hospital Foundation is the fiscal sponsor, and $159,748 have been raised so far. And to apply or to donate, I'm going to put the link in the chat, but you can go to Nevada County Relief Fund. So it's nevcorelief.org, and there'll be information there for you. So to apply or donate. And then there's also a link on that page if you'd like to donate to Placer County residents impacted by the river fire. And the rest is, and a reminder, please do, if you haven't ever utilized the resource 211, they're open 24 hours a day. It's free, and you can call 211. So for anybody who's technically challenged, for anything, whether it's for code red information, anything that you have questions about, anything at all, you just call 211. So that is something that we also want to make sure people know about and keep spreading the word about. And with that, we have some guests today, some panelists that we wanted to highlight. We want to show things that are happening in the community that are great. And first up, we have Eliza Tudor, the Executive Director of the Nevada County Arts Council, and she's going to speak to the arts community response to the COVID virus, Delta variant, and all the things that are happening this year, the changes. So Eliza, take it away.
Thanks so much, Marnie, and thanks for inviting this creative sector update. As you know, we're a significant sector of scores of small businesses run by artists and over 100 arts agencies, collectives, and creative businesses within the nonprofit and business sectors, with pre-pandemic and economic impact of almost 47 million. So in relation to leadership response within the creative sector, for us, it's all about the balance of helping our staff, audiences, and patrons feel welcome and safe, while ensuring that everyone has access to opportunities to capacity building support towards creative sector recovery. The Nevada County Arts Council hosts a COVID resources page at nevadacountyarts.org, which is updated regularly. And I'll be, after I finish my little presentation, I'll put some links in the chat. So we're convening creative sector leaders of arts organizations and creative sector businesses every other Tuesday at 5:30 by Zoom to share best practices and exchange vital information to help us better serve our communities. I'm going to put my email address in the chat after this, so that if there's anyone listening that doesn't know how to contact us about this, you'll be able to let me know, and we'll invite you in. And our next meeting is on Tuesday, the 14th at 5:30. We've also added a section to our COVID resources page called The Art of Reopening. And we borrowed this phrase from an important guide from the National Endowment for the Arts called The Road Forward, a guide to current practices among arts organizations during COVID-19. And you'll know, Marnie, already, and everyone on this call, that local performing arts venues issued a joint statement recently regarding COVID-related protocol. And you can find that at Ubinet. And again, I'll copy that over. So each venue has their own requirements, so that individuals will need to refer to each venue for specific details. But having said this, efforts are underway to create a dedicated page where any member of the community can check on protocols at venues that opt in. And this will include both creative sector venues and the broader business community. So more to follow about that. We have also launched a reopening for the arts COVID-19 safety protocols survey. I'll include a link to that. And our aim is to track and share COVID-19 strategies to re-engage our audiences and patrons in order to help inform local solutions and guide key conversations among the sector. We're hoping that by sharing these common practices among our arts organizations, venues, creative business and collectives who have successfully reopened to some degree or to any degree their doors to audiences or visitors, as the pandemic wears on, we can learn from one another. And we'll be sharing the results of that survey. So in relation to creative sector response to the county's Community Resilience Grant Program, and of course, we know that the deadline for that is coming right up on September the 10th. It's very important for Nevada County Arts Council that we're encouraging and engaging applications from small and mid-sized arts organizations who may not be so used to applying through this kind of, rather formal process. So we're offering a free workshop for creative sector leaders, which we're calling the Community Resiliency Grant Program Demystified. And we're hosting that with Sierra Business Council. Thanks so much, Kristen York. This coming Friday, September the 3rd at 11 a.m. And again, I'm going to put a link to how you can jump on board with us for that. It's very important to us that we can show as a sector that we're ready to take up on this sort of challenge, if you like, from the county to engage and responsibly support our organizations. Lastly, because I know I'm on a timer, just to say, in relation to fire season preparedness, we have a page dedicated to this, which we put up last year at around just before the Jones fire. And it's nevadacountyarts.org fire season preparedness. And I'll share that in a moment. And here we share local resources, arts and culture readiness, and emergency relief and assistance. Importantly, we're pushing out once again our Find Your Five and Share Your Plan card, which we created in tandem with the county last year. We want our creative sector to be ready and are asking artists and organizations to prepare. And on emergency preparedness with fire in mind, we've just submitted a significant application to the National Endowment for the Arts for a county-wide recovery plan, a cultural plan, which takes into account both recovery from the pandemic and fire season preparedness, emergency preparedness at its heart. And in relation to fire, of course, we have our enormous exhibition that's going to be opening in the eastern part of the county called Forest Fire, not a moment too soon, at the Truckee Recreation and Park District in October. And I'll include links to that in the chat. So again, I know I'm on a timer, so I'll probably stop there, Marnie. How did I do?
I think that was fantastic. Thank you so much. So if there's any questions for Eliza, please do drop them in the chat and we'll just keep dropping links in there so that you can click and save them in your tabs. Yeah, there's a wealth of resources on the Nevada County Arts council page, and they also have a Facebook for the Grass Valley Nevada City Cultural District, as well as Nevada County Arts. So you should keep track of all of that. Right. No specific questions right now. We'll move to our next guest, which is Chris Marr, General Manager of Briar Patch Co-op. And they've been doing a really great job taking care of business. And we wanted to invite Chris to talk about that a little bit today. Welcome.
Thank you. Thanks for saying that, and thanks for having me here to talk about how Briar Patch has responded to the pandemic. It's been quite an interesting year and a half for us. Thinking back, this was an opportunity for me to reflect on those 18 months and really kind of walk back through the path that we took. For us, during the initial period at the beginning of 2020, before the pandemic was really clearly hitting the United States as hard as it ultimately did, we began to see a change in the way customers were purchasing and noticed a tendency to stock up. We have long had a special order program where folks can order case sizes of products. And in January and into February, we suddenly saw an uptick in those sales that was really significant. And it was the first clue for our team that something was changing and that folks were taking this pandemic threat more seriously than we necessarily knew they would. And that was coupled with the increase of focus that the pandemic was getting in the news. I guess I should pause and stop just in case anybody's not familiar with Briar Patch. We're a community-owned, cooperatively owned grocery store in Nevada County, and we have about 10,000 active owners. We do about $40 million in sales. And what's unique about us is that we are a cooperative. We're owned by the community, who elect a board of directors that hire the general manager and direct and run the store. So we have an obligation to our ownership and certainly to our staff to respond to anything that's happening out in the world. So as we began to understand what was going on, it was the first, as I said, the first clues were coming from supply chain issues and an increased demand on staple items that folks were ordering up. So we initially formed a pandemic response team within the context of our management team. And we set to work immediately kind of researching what standard generic responses to pandemics in general, what best practices were, and putting together a document that would allow us to create a pathway for anything that came up. And as I think everybody experienced, throughout really the first year of this, the decision making was happening on an incredibly fast pace. There was things that would come up really hourly for us to respond to. What proved to be our best guiding light right out of the gate was using our obligation to our staff to make them feel safe as the top criteria for how we handled any particular decision that we faced. And that has proven to be absolutely the best way to look at this. We all remember in the early days, the shutdown, everybody was working from home or not working at all. There was stop of most activity, but healthcare workers, food workers, and a few other industries were designated essential. And there was an initial kind of narrative around that about heroes. And that was a good way for us to increase the level of communication that we have with our staff. We have over 200 staff members that work at our store. The number sometimes surprises folks. There's a lot of people behind the deli walls when you're over there ordering sandwiches and whatnot. So we created a pipeline for communication with our staff members to understand where they were at and what they were hearing and what their concerns were. We implemented hero pay. We put a premium, effectively a hazard pay, to help people continue to be motivated to show up at work and to reflect the challenges that they were having. And we put into place, the protocols that I think most folks who shop at the store saw fairly easily. We began to partner with public health and understand that there was concerns around self-serve items. Our bulk department being a large part of our sales floor, we modified the practices in that department so that people could shop safely. We got clear on what the approved list of cleaners and sanitizers were, and upped our cleaning protocols in the store, and worked with both public health and environmental health to make sure that what we were doing was reflected the best understanding of how the disease behaved at that point, and made changes as we learned more. We bumped up staff resources in a significant way. Where we could, we implemented work from home. We changed our office layout and our retail layout to allow for social distancing more effectively, to cue people to be able to kind of do that visual estimation of how to stay apart from each other. Well, and we ultimately, of course, began metering the number of customers that were allowed in the store down to, I think 30 was our lowest number at one point. And of course, requiring masks. What was really profound, I think, was the expression of appreciation and support, and to some degree concern, that came from our ownership. The customers immediately responded to that, and reached out either to me directly, to the staff on the floor, or in some cases signing up for board meetings on Zoom, which of course made it easier to express their appreciation for our dedication to making the environment safe. Being a relatively small building doing $35 million in sales each year, it's a high volume, high traffic area. And as anybody who's shopped there, particularly in the holiday week or whatever, knows, that means it's crowded. So all of these protocols really helped to address that, and not with any real meaningful impact on people's ability to get what they needed. The one exception to that, of course, was the supply chain disruption that occurred as the pandemic took hold. We are a member of a group of cooperatives that operate and work together nationally, called NCG, National Cooperative Grocers, and they have a big part in our relationship with our suppliers. So through that network, we were able to coordinate with our large-scale distributors and bring in a lot of those products that were in high demand, and address many of the supply chain issues that were significant at the beginning of the pandemic, and then really continued. I mean, to this day, we still see stress in the system that we're working to address. And that's coupled not just with the prepping that folks are doing to feel safe, but just the simple fact that for a good many of our customers, they have shifted their behaviors from dining out a significant portion of their meals to cooking at home more often. So we saw an uptick in baking. Our baking set suddenly went. We were selling flour more than we usually did, eggs and things like that. So that coordination and that combination with the other co-ops in our area allowed us to manage our supply chain a little more effectively than I think some other stores were able to do. Really, as this has to some degree, I mean, I hate to say it, but as it's normalized, we've kept that pandemic response team in place. It's a small group of senior leaders that meets on a bi-weekly basis and reviews what has happened and looks at what decisions are upcoming, and manages communication both internally to our staff and externally to our customers and to our owners and to our board of directors. And keeping the volume of communication in all those directions full and operating functionally in both directions has really proven to be the success, and allowed us to be nimble and to keep everybody as safe as possible. That's the Briar Patch story as best I can encapsulate it, but I'm happy to answer questions if anybody has some.
Thank you, Chris. I don't see any questions specifically in the chat just yet, but just wanted to say thank you. Looking at your webpage, we can all see how generous Briar Patch is to the community. You're also doing, fundraisers for firefighters and the Caldor Fire, and you can round up your purchases for the co-op of the month, all sorts of great stuff. So thank you very much for coming on today.
It's nice to be here with y'all.
Thank you for your good work. And next up, we move to more business resources with Kristen York, who's Vice President of Sierra Business Council Small Business Development Center. And she's going to tell us more about what we have to support businesses in here in California and Nevada County. Welcome, Kristen.
Thanks, Marnie. Hi. Yeah, I'm going to tell you about 4 programs that be applicable. The first one up is the California Relief Grant Program that I know a lot of businesses applied for. There was a second round of funding through the state of California, and there are 2 more rounds. So round 7 just closed. The notifications, if you applied or were on the wait list, will go out through September 16th. Round 8 is open, and this is only for nonprofit cultural institutions. And if you applied in round 4, which was exclusively for nonprofit cultural institutions, you do not need to reapply. But if you applied in round 1, 2, 5, or 6, you must fill out a new application. I don't make the rules. We just help people. So I know it's probably confusing. And then the final round will be round 9. This will open on September 9th. It goes through September 30th. And that's for all waitlisted businesses or nonprofits that were not selected and any new applicants that meet the criteria. So at the end, I'll put in the chat the websites to access all this information, but that is carereliefgrant.com. And I'll give you an 800 number if you're struggling through anything with your applications. Next up, Shuttered Venue Grant. So there are some supplemental grant funds, and those are by invitation only. They will be for initial grantees that suffered the greatest loss. That is 70% loss compared to your 2019 first quarter revenue. And again, that is by invitation. So if you feel like you're in that category and you did not receive an invitation yet, they're still going out, but it's best to either to contact SBA directly. Also with SBA, there are numerous wildfire disaster declarations, and they are pegged directly to specific fires. So in Nevada County case, the river fire is under disaster declaration. Their virtual recovery centers are now open Monday through Friday, 8 a.m. to 8 p.m. I will give you the 800 number. It's 800-659-2955. Again, I'll repeat in the chat. And this is for homeowners, renters, or business owners. Loans of up to $2 million for any replacement, repair, destruction. This is for real estate, machinery, inventory, other business assets. There are also economic injury disaster loans for working capital where you didn't have to suffer property damage. Let's say your store or business was closed for a number of days because of the fire or the internet was down, et cetera. You can apply for those loans. These are great loan products. The interest rates are all below 3%, depending on which one you qualify for. Applications are available at disasterloanassistance.sba.gov. I will put that in the chat as well as soon as I'm done. And then finally, and Marnie mentioned this and Eliza mentioned this, but the Nevada County Community Resilience Grant closes on September 10th. We are fielding a lot of calls about this grant. So I just want to clarify some of the most confusing things for people is that you must create an account on the county's purchasing site. So it's a little unusual for a community grant to do that, but that's how you access the application. And the most common questions we're getting are, one, about the amount. They're up to 100,000, but we have applications as low as 10,000 coming in. So know that you need to go for what you can justify, not necessarily a stretch goal. You have to show impact from COVID. This is not for general operations, not fire related, not startup. It has to be related to the COVID shutdown because these are federal funds that are being passed through the community. The guidelines are very clear in the application, and you must have some damage related to those guidelines. It must be specific with the community. So some of the other questions we're getting around, how do I prove what demographic? I'm like, well, it's whatever your organization is serving. If you're serving seniors or youth or any kind of disadvantaged group or regular everyday people, you just need to kind of know your numbers. You need to know your operations. This will be a competitive grant. So those are the updates I have. I will put these links in the chat, but I'm also open to any questions if anybody has them.
Okay. That's a lot of information.
Yes.
Thank you
It
so
looks like
much.
Jess already put those links in, because she's amazing. So this is great. Thank you.
Yeah, that's great. So if you follow the links for the Community Resiliency Grant, there you can email Desiree Belding for an addendum. So there was a Q&A period up until the 31st of August for applicants to ask questions, and that period has closed. So they will put together frequently asked questions, send that out to anybody that asks for it. And it should also be put up on the website, at the county website under the Community Resiliency Grant. And it'll be out on social media, everywhere. So with that, we have next steps. So our next meeting is November 3rd. We're meeting every other month at this point. And we just want to say thank you for joining us today, for getting the information out to people that need it. And we have one more thing I'm going to put in the chat as we close with closing comments. We have a Veterans Appreciation Week coming up, and the county would like to invite you all to a webinar, which is on Tuesday. I'm so sorry. It is Thursday, and that is tomorrow. There's a Zoom meeting September 2nd at 2:30. And that is regarding a Nevada County Military Appreciation Week, Support Our Vets program. So I will put that in the chat, and I will also put a link to our Facebook group, which is Collaborative Resources for Nevada County Businesses, and a link to sign up for a business task force email list. And that is something that is just put out every so often so that we can keep whoever signed up for the emails up to date on all these business opportunities in a timely manner. And so with that, I'm going to turn it back to Supervisor Miller and Supervisor Schofield for closing comments. I'd like to thank all the panelists and attendees for sharing and attending. So go ahead.
I'm glad, Marnie, I'm glad you gave the locations for those, the PPE availability, because people be wandering around all over the place. But yeah, the chambers and the Contractors Association, probably the most accessible places to get that PPE that's still available. We'll see what happens rest of the week. Huh, Ryan? That's all I have, Marnie.
All right. I believe Ryan had to jump off and make a phone call. So Supervisor Schofield, back to you.
Well, I want to thank Eliza and Chris for their time here. And, you know, I think that Chris is the one that kind of said it when he said, I hate to say this, but this is almost normal. And I suspect that that's why we really didn't have any questions today. It's almost become normal. And you know, I look at, I guess, fairly dramatic restrictions now. Wear a mask, you know, that's, and if we are normal, then you have to kind of normalize yourself. If you're not going to get a vaccination, then come on, get a test if you want to do some of these particular events. It's very frustrating. I think Ryan will tell you that we're one of the highest counties in the state. It's like, aren't we proud? I think we were the second highest county in the state. So I know it was very tough decisions for Dr. Kellerman. Not easy at all. But it is what it is. And continue to say a year and a half later, we will get through this. Thank you, Maureen.
Thank you, Supervisor Schofield. Anything else to add, Ryan Groover?
No, I appreciate those comments. I will say we were second worst in the state. Some other counties, unfortunately, have seen higher case rates. There's some pretty bad situations in other counties. So we, unfortunately, we're not alone, and it's a statewide thing where everybody's seeing a huge uptick in cases. So.
Thank you, Ryan.
Well, we want all of you guys to take good care of yourselves. Thank you again for attending and for spreading all the information that we shared with you today. And this recording will be up on the business resources that is on the Nevada County website. So that's mynevadacounty.com/3143/business resources. And I'll just pop this in the chat. There's a lot of information here. I'm going to save the chat and all the links, and we'll put all of this information in a newsletter. So please do sign up. And with that, have a wonderful afternoon, everybody. Take good care.
Thanks, Marnie.
Thanks, Marnie.